Good evening. Welcome to another edition of the MHA News Hour on Channel 711. I am your host, Kurt Brand, and we have a very special show for you tonight and a very special guest. Tonight's topic is hospital readmissions. And why is hospital readmission such an important topic these days? There's several reasons. One is the quality of care is compromised, and we're always looking to improve that. Safety is another important issue with hospital readmissions, and costs. For every readmission, there's costs associated with that. And in the world today in healthcare, we're always looking at ways to improve these three areas. Our guest tonight, we have a very special guest. He led a project at DeKalb Medical Center in Georgia to reduce hospital readmissions. Their project was published in the Journal of Professional Case Management, and we're happy to have him on our show tonight. So let's bring him on. Samron, are you there?
Yes, I'm here. Yeah.
Great. Welcome to the MHA News Hour.
Thank you very much. Yeah.
11. So first, Samron, talk about the opportunity at your hospital. What were you guys seeing as far as the problem that you are running into with hospital readmissions?
So in today's pay for performance environment, hospitals are under increasing pressure to improve quality and safety while containing cost. It's a very difficult task, and according to the Medicare Payment Advisory Commission, as many as 18% of all the Medicare patients are readmitted within 30 days of discharge. This statistic suggests that patients are not adequately prepared at discharge to care for themselves at home.
What would you say the financial impact of these readmissions was at your hospital?
Right. So the unadjusted cost per case related to 30-day readmission is $8,033 for HF and $10,549 for AMI and $7,816 for pneumonia. This translates into an annual excess opportunity cost for $3,59,500. And if the hospital is not successful in reducing 30-day readmission, the penalties could be severe. The cost is reimbursement for the federal fiscal year 2013 is 1% of total Medicare reimbursement, increasing to 3% by federal fiscal year 2015. For this organization, $1.8 million is at risk annually.
Wow, $1.8 million annually. If you're the chief financial officer of an organization, that's a lot of dollars out there. And like we mentioned earlier, if 75% of the readmissions were avoidable, that's a lot of money left on the table that could be used to provide other services. What tools did the team use to better understand, the root cause of the problem?
Right. So to better understand the causes of the problem, the DIT developed a supplier input, output, and customer flow diagram, which was used to illustrate the key steps in the discharge process, beginning with the admission and ending with discharge. The DIT created an Ishikawa or fishbone diagram, which illustrates cause and effect relationship between processes, people, policy, and plan. Failure to address these components of the process can result in an ineffective discharge process, resulting in increased 30-day readmissions. Risk assessment conducted for 150 readmitted patients included the voice of the customer interviews to learn about the customer point of view regarding service issues and gaps that prompt readmissions. And a full day Kaizen event was held to identify the steps needed to correct waste, gaps, and barriers in current processes. The DIT created a failure mode and effect analysis for further validation and prioritization. Through the use of brainstorming techniques and multi-voting, the process improvement action steps and tools were also identified in this case. Yeah.
Wow. I can tell that you guys used a lot of tools. You know, you mentioned the fishbone diagram, uh, the Kaizen event, failure mode, and effect analysis. Those are all great tools to help you really drill down and get to the root of the problem. What what were some of the preliminary results of the project related to the readmissions?
So for this project, various Lean Six Sigma tools were used to outline the current process and identify areas for implementation of lean processes. Currently, discharge appointments are made for 6 to 8 patients per day who are discharged from the pilot unit. In the first 30 days of the pilot, 86 patients have been referred to the discharge clinic with a 50% no-show rate. The discharge clinic staff calls all of the no-show patients to follow up on their status. As a part of that phone call, the discharge plan is reviewed, including medication, and follow-up visit is confirmed with either the discharge clinic or the PCP. So in the first 30 days, the clinic contacted 40 patients, 20 of whom intended to keep their PCP appointment. Early, early results suggested that new processes is having an impact on readmissions. After 30 days, the admission rate for the 46 patients seen in the clinic was 6.5%, compared with the baseline readmission rates for the pilot unit of 16.2%. And but it is still too early to predict the long-term effects of the new discharge process. If the project continues to show success, the plan is to deploy the same process across the organization.
Very good. Yeah, going from a 16% readmission rate down to a 6.5% is that's a huge impact not only on the patients but on the financial bottom line of the hospital. And I think a point that you made earlier that 50% of these patients were no showing to their primary care appointment, and wow, that's a huge flag. And by addressing that, I think that certainly puts you in a position to be successful for these patients to follow up correctly in their aftercare.
Yes, and those were very interesting results for us as well. And I think Lean Six Sigma helps a lot.
Yeah. Samron, congratulations. Can you talk a little bit more about how Six Sigma and Lean helped you in this project?
So decision to use Lean Six Sigma methodology was effective and provided the tools and structure for this project. The discipline and tools resulted in a comprehensive approach to the problem of readmissions. The integration of acute care and post-acute care providers on the team assured the patients receive safe, timely, and effective care across the continuum, and readmissions can be reduced as a result of a discharge plan that assures follow-up post-discharge with a PCP or a transitional care clinic.
Wow. Samron, congratulations on your efforts of your team. And thank you so much for coming on our show tonight. I wish you nothing but the best moving forward, and we're excited to hear how you implement these processes within your whole hospital system. So thank you for that.
Thank you for having me.
Yes, my pleasure. After a short commercial break, we will be back with Dr. Karupin as she continues her lecture on Lean and Six Sigma. Stay tuned.